Hello. Weight loss medication, section number 6. Hello, I'm Dr. Martyn Chilvers, Medical Director of the Triad Weight Loss Clinic in Sarnia, Ontario, Canada. Thank you for your interest in learning how to lose up to 30% of your current weight by following my methodology. This is a 6-part series showing you the steps that the Triad team and I take with patients to help them obtain their weight loss goals. This is the final part of the 6-part series. When it comes to weight loss, I find that most people do much better with the aid of medication for weight management. In Canada, there are only 3 medications officially approved for weight management. They are Orlistat, trade name Xanacal, a combination of bupropion and naltrexone, trade name Contrave, and liraglutide, trade name Saxenda. In other countries, there may be other options, and although I don't have experience with these other options, I sincerely doubt that they work as well as the medication I now most commonly use. The medication I use, however, is not an approved medication for use as a weight loss drug at the present moment, any place in the world. This is an important consideration in that what I am doing hasn't been sanctioned by any health authority at the present time. The medication is, however, approved as a treatment for type 2 diabetes mellitus. The medication I most commonly use and find the most effective is called semaglutide, which is sold under the trade name Ozempic. Semaglutide is approved by various health authorities for the management of type 2 diabetes. Semaglutide is under development and investigation for weight management and also for the treatment of fatty liver disease, but is not yet approved to treat these conditions. I felt comfortable using the medication semaglutide for weight loss after the phase 2 dose-finding study was published in the British medical journal The Lancet. The efficacy data and the safety data from that study suggested to me that it was a more potent medication than Saxenda and that the safety profile and side effect profile was virtually the same as Saxenda. Saxenda was the medication I had most commonly used in weight management for my patients. I was already experienced in using semaglutide, or Ozempic, for the management of my patients with type 2 diabetes. At the time of this writing, the phase 3 studies for semaglutide as a weight loss drug are coming to a conclusion, and the step 4 study results have recently been released. Results of this phase 3 study further reassures me on the safety and efficacy of semaglutide as a weight loss medication. In my experience of using semaglutide as an anti-diabetic medication, I was very impressed by how powerful a drug this was in helping correct my diabetic patients' blood sugars and also seeing significant associated weight loss in these diabetic patients. Now, the maximum dose of Ozempic used to treat type 2 diabetes is 1 milligram weekly. Yes, only once a week dosing. For weight loss, though, the maximum dose I use is 2.5 milligram weekly, a dose significantly higher than what is approved for the treatment of diabetes. Furthermore, the dose used in the Step 4 study was 2.4 milligram weekly, and the average weight loss in that study was 17%. Of course, this is an average weight loss. Some patients did better, and some patients did not do as well. My patients who receive semaglutide and follow my exercise prescription and see Lisa Chilvers, the nutritional counseling and acceptance and community therapy counseling, are seeing weight loss in the 26 to 28% range after about 9 to 12 months of therapy. This degree of weight loss is unprecedented in my weight loss practice. The best patient has lost 30% of her weight. Bariatric surgery, I believe, is the only other intervention that can result in more weight loss than this program that I am currently following. Gastric sleeve surgery results in a 20 to 30% weight loss. Roux-en-Y gastric bypass surgery generally results in a 25 to 35% weight loss. And biliopancreatic diversion with duodenal switch surgery results in a 30 to 40% weight loss. Bariatric surgery clearly gives rise to impressive results, but unfortunately, this comes with increased risk. There is the possibility of surgical complications with every surgical procedure. And for bariatric surgery, one of those complications can be death. The operative mortality risk, meaning death within 30 days of surgery, is 1 in 1,000 for gastric sleeve surgery, 5 in 1,000 for Roux-en-Y gastric bypass surgery, and 11 in 1,000 for biliopancreatic diversion with duodenal switch surgery. If you decide to have surgery, make sure that you have a very experienced surgeon, as the more experienced the surgeon, the less the risk. The other issue with surgery is weight regain. This is more likely with gastric sleeve surgery, somewhat likely with Roux-en-Y gastric bypass surgery, and less likely with biliopancreatic diversion with duodenal switch surgery. In one study, 59% of patients who underwent Roux-en-Y gastric bypass surgery regained at least 20% of their weight lost. And certainly I've seen patients at the highest weight in their life, 5 years or more, following Roux-en-Y gastric bypass surgery. With more robust medication available and improved psychological therapy and support, non-operative medical intervention is becoming a viable option for many who suffer from obesity. Now, let's get back to talking about the medication semaglutide. When I prescribe this medication, I am prescribing it off-label. Both the indication and the dose are off-label. This means that semaglutide is not approved for weight management, and the dose is not approved for any indication by Health Canada. Doctors are allowed to prescribe medication off-label as long as they inform the patient that it is off-label, and I can tell you that physicians very often prescribe medication off-label, presumably when they believe that the benefit outweighs the risk in each individual patient's case. Now, I'm licensed to practice medicine only in the province of Ontario, Canada. So if you live outside of Ontario, I cannot prescribe to you. So you will need to see your own doctor to get a prescription. It's possible that your own doctor may not feel comfortable prescribing semaglutide off-label to you. If this is the case, I'd suggest using Saxenda instead. Saxenda would be on label for weight management as long as your body mass index is 30 or greater, or 27 or greater in the presence of at least one weight-related morbidity. For example, if you had high blood pressure, type 2 diabetes, or dyslipidemia, meaning high cholesterol. The patient should also have failed at least one previous weight management intervention, according to the label. Liraglutide, trade name Saxenda, was my favorite weight loss medication before I switched to semaglutide, trade name Ozempic. Both medications are injectable using a pen device called a FlexTouch pen, and the needles that I prescribe for this pen are called NovaFine Plus needles. The pen technology and the NovaFine Plus needles are brilliant. When you use this pen device, it literally does not hurt to self-inject. Nobody seems to believe me when I tell them, but it's true. It literally does not hurt. Saxenda is injected every day, and Ozempic is injected once a week. The two medications have a lot in common. They belong to the same class of medications called GLP-1 receptor agonists. This means that they stimulate the GLP-1 receptors located in the pancreas and in the brain. Now, the clever thing about this medication is that if your sugar level is normal, it doesn't act on the pancreas. This way, non-diabetic patients don't have to worry that their blood sugar will go too low. How clever is that? How cool is that? Ozempic seems to be more robust than Saxenda in stimulating these GLP-1 receptors and the appetite centers in the brain that results in less hunger, quicker satiety, and less cravings. Let's now talk about side effects of the medication. Saxenda and Ozempic are very similar, with the main side effects being nausea, vomiting, constipation, and diarrhea. To mitigate the side effects, we start both medications at a low dose and gradually titrate the dose up as long as the patient is tolerating them. Because there is no label for titrating Ozempic to 2.5 milligrams, I decided to use the following regimen, which seems to work quite well in that it is well tolerated by the majority of patients. Some patients may experience mild nausea that's transient and manageable when the medication is used this way. For Ozempic, I start with a dose of 0.25 milligram once a week for a month. Then I titrate the dose up to 0.5 milligram weekly for a month. And then I increase it to 1 milligram weekly for a month, then 1.5 milligram weekly for a month, then 2 milligram weekly for a month, and then finally, after 5 months, 2.5 milligram weekly as the long-term maintenance dose. In the phase 3 study, called the Step 4 study, the dose of semaglutide was 2.4 milligram weekly as the long-term maintenance dose. I chose the 2.5 milligram dose for simplicity in guiding patients. The FlexTouch pens are not currently designed to give 2.4 milligrams or 2.5 milligrams as a single dose because I'm using the pens off-label. The pens come in two different sizes. There is a 2 milligram pen that can administer the 0.25 milligram or 0.5 milligram dose, and then there is the 4 milligram pen that is designed to only administer the 1 milligram dose. To administer 2.5 milligrams of Ozempic, I have the patient administer two 1 milligram doses from the 4 milligram pen and 1.5 milligram dose from the 2 milligram pen to make a total of 2.5 milligrams. Alternatively, the patient uses the 4 milligram pen to administer two doses of 1 milligram, and then using the same pen dials up 35 clicks of the pen, which approximates 0.5 milligram, and then administers that. This latter technique is more prone to dosing error, but it turns out that this technique is cheaper, and if you're a cash-paying patient, you really appreciate that. If this is all too confusing, your doctor or your pharmacist should be able to help guide you to give the correct dose. As you are titrating the dose, do not increase the dose, even if scheduled. if you're only just tolerating the current dose. Wait until you feel well before increasing the dose higher. Also, if you are not tolerating a certain dose, step down to the next lower level that you did tolerate, and after a few weeks, try raising the dose again. The occasional patient will use gravel to help relieve any nausea, and some patients need to use a laxative like Restoralax to help them combat constipation if that becomes an issue. Okay, but what about the safety of the medications? Saxenda and Ozempic. The safety concerns of Saxenda and Ozempic are the same. Firstly, in rat and mice studies, both medications do show an association between drug exposure and the development of thyroid cancer. That, of course, sounds very concerning, but fortunately, there is no evidence whatsoever that these medications cause or can cause thyroid cancer in humans. Indeed, neither Health Canada nor the FDA in the US would have approved the use of these medications if they suspected that they could cause cancer in humans. If you were a rodent, then you would definitely have a concern. What is a real safety concern is the increased risk of developing gallstones and symptomatic gallbladder disease and acute pancreatitis. Folks who lose a significant amount of weight for any reason are at increased risk of developing gallstones in the gallbladder. This can then trigger gallbladder attacks severe enough to warrant surgical removal of the gallbladder. Very occasionally, a gallstone will escape the gallbladder and block the pancreatic duct, and this can trigger acute pancreatitis, which is a potentially life-threatening illness. Fortunately, none of my weight loss patients have developed pancreatitis, and I believe it is a very uncommon complication of therapy. Now, that covers the relevant safety concerns, so let's talk about other benefits of these medications. Both medications have been proven in medical studies to reduce the risk of heart attack, stroke, and death in the diabetic population. At the time of this video, there is no completed study proving the cardiovascular benefit of these medications in the non-obese, rather in the obese non-diabetic population. Since obese patients are at increased cardiovascular risk, it is likely that cardiovascular risk reduction is also a benefit from these medications in the non-diabetic population as well. These medications have been proven to reduce the risk of developing diabetes and of developing prediabetes. All in all, and on balance, pretty good stuff. So, who should not be taking these medications? Well, if you're pregnant or nursing, you should not be taking any GLP-1 agonist, including Saxenda and Ozempic. If you have a personal or family history of medullary thyroid cancer, then you should not be taking any GLP-1 agonist. If you have a personal or family history of multiple endocrine neoplasia syndrome type 2, then you should not take these medications. If you're under the age of 18, then this medication is not for you, as it has not been tested in your age group. Patients often ask me how long they need to be taking these medications for. Please understand that being overweight is a chronic medical condition and you require lifelong treatment. Will you remain on Ozempic for the rest of your life? No, as there are even more powerful medications in the pipeline that are coming that will help you lose even more weight if needed. you do require lifelong treatment if you suffer from the medical condition of obesity. This is an exciting time to be alive. It's an exciting time for weight loss, as better medication is coming to the marketplace in the not too distant future. Current treatment works very well, and we will have even better tools within the next few years. I'd like to finish by summarizing some key concepts about weight management that you should keep in mind. Number one, many folks are not able to achieve the so-called ideal weight, so please focus instead on looking for your personal best weight that can be achieved with the best medication available and the best cognitive restructuring therapy available while following the healthiest lifestyle that you can still enjoy. Point number two, a typical diet is the smallest number of calories and the greatest amount of exercise that a person can endure, while a healthy lifestyle is the smallest number of calories and the greatest amount of activity that you can enjoy. Remember, if you do not enjoy your lifestyle, you will not be able to maintain it in the long term, and this is why diets almost always fail. A normal person, and you are a normal person, cannot tolerate a diet for long if they don't enjoy it. The use of medication to help you lose weight and maintain that loss is not an admission of personal failure, but a recognition that being overweight is a real medical condition that can benefit from proper medical treatment. If you have failed to lose weight and keep it off in the past, do not consider that you are a personal failure, that you are weak-willed or somehow inferior. Consider that you are human and you simply never received the proper treatment that included the best medication available and the best cognitive restructuring therapy available. If you live in Ontario, and if you wish to see me for weight management consultation, then I suggest that you ask your family doctor to refer you to me by faxing a consultation request to 226-319-1341. If patients anywhere in the world wish to see Lisa Chilvers for nutritional counseling combined with cognitive restructuring therapy counseling that she calls the loving kindness method, then contact her at lisa.chilvers@me.com or visit her website at lisachilvers.ca. If you enjoyed this series of talks on modern medical weight management and find them useful or educational, then please share them with your family, friends, and neighbors who you think may be interested in viewing them. If you enjoyed the video and found it worthwhile, please click on the thumbs up icon and subscribe to my YouTube channel by pressing the subscribe button below. Lastly, if you wish to read my book on this subject, you will find it published on Amazon. Thank you, everybody. You have a good day. Take care.